My name is Tara Sklar. I am a professor of health law and the director of the Health Law and Policy program at the James E. Rogers College of Law at the University of Arizona. And I am really delighted to present my current work with my co-author today as part of the Petrie-Flom 2022 annual conference on diagnosing in the home. Our project focuses on digital home health in terms of a very specific patient population, and that is those who are Medicaid eligible, older adults, those 65 and over, who wish to age in place. And the reason we're focusing on this population as part of this conference is because we think this group is prime to be at the forefront of leading the way in terms of how we adapt digital home health in the future, especially in terms of aging in place and long-term care. And that is for three reasons. The first being demand, the second being very surmountable policy and practice changes, and the third are the opportunities ahead if we were to prioritize this population. So I'll just give a little more detail into each of those and then turn it over to my co-author. But in terms of demand, we've seen enormous demand from patient populations who very much wish to age in place and not go into a skilled nursing facility. Also, we have the trajectory of a much larger aging population, where those 85 and over are the fastest growing segment of our population who will need additional support. And we're also facing tremendous workforce shortages in the healthcare workforce, along with very high caregiver burnout. So for all these reasons, looking at the home in terms of aging in place is coming to the forefront. And then the reason to focus on a Medicaid eligible population is because we have home and community-based service waivers that every state has, where they can target this particular population and provide the flexibility and oversight to really help this population age in place, as well as continue to evolve with what may be coming down the pipeline as technology advances. But there are some changes that need to happen with these waivers for that to come forward. Additionally, telehealth is a very much evolving area, and there are some limitations in terms of what Medicaid covers that need to be part of this conversation as well, which we propose. And thirdly, in terms of practice changes, there are some diagnostic errors that could be corrected with additional digital home health. Lastly, enormous opportunities. If we continue along our current trajectory, it is absolutely unsustainable in terms of supporting aging in place with this population. So it's vital we move that way forward. And I'd like to turn it over to my co-author now, who's going to focus on specifically digital home health in terms of older patients.
Thank you so much, Professor Sklar. I am Dr. Kathryn Huber. I'm an internal medicine resident physician at the University of Colorado. I'm also a professor of practice at the University of Arizona College of Law. And as Professor Sklar mentioned, there are some very unique considerations that help us to focus in on HCBS waivers in the care of older adults very specifically. So older adults, we know, are uniquely vulnerable in terms of their limited access to long-term care and limited access to home health modalities. They also have a higher burden of multiple comorbidities and require very complex care. And they are also at risk for sensory and cognitive impairments, which make them a very unique population, quite susceptible to some of the risks posed by digital home health technologies, especially when employed in the home. For these reasons, older adults are a perfect case example for us to focus in, especially with HCBS waiver modernization. We propose a framework that keeps ethics at the core, that addresses specifically issues of efficaciousness in the use of older adults, making sure that older adults are the appropriate patient population to use these technologies in, one that focuses on safety of older adults given their unique vulnerabilities, and also one that addresses the unique privacy and security issues, especially as these technologies enter into the home. So through modernization of HCBS waivers, we hope to improve access and create greater flexibility for digital home health, especially in long-term care populations, to improve the safety of care provided in the home, and as well as address costs and staffing shortages that are quite burdensome in this unique population. So we're very excited to share our work with you, and very grateful for the opportunity to work with the Petrie-Flom Center at this conference.
What is one thing we'd like people to know about this topic of modernizing Medicaid's home and community-based service waivers with at-home diagnostics and home telehealth? And so there are 2 points I'd actually like to focus on as part of this one area, and it is that We talk a lot about the digital divide in terms of digital home health and what that means. And we say the population groups that are especially vulnerable, those who are lower income, the older adults with less education. If we were to make this a reality and really support the ability for home and community-based service waivers to offer digital home health, we would be directly addressing that digital divide, which I think is critical. I think it's a way to stop talking about the digital divide and really take active movements across the country to implement it. And secondly, our current trajectory is not sustainable. States are breaking now under the ability to provide long-term care for their older adults. So this is the prime time to take what we've learned from COVID in terms of providing digital home health in the home and telehealth from the home to really act and support this particularly vulnerable population that wants the option to age in place.
What is your prediction for how this area will progress, or what you would like to see happen in this area? Well, one thing that we're concerned about is this area continues to progress without an intervention such as HCPS waiver modernization, that these existing inequalities and disparities in the care of older adults, especially in long-term care, will be exacerbated and worsened. So areas such as the digital divide will be worsened, social isolation and loneliness will be exacerbated, and non-person-centered care will fall by the wayside. We would like to see a modernization to HCPS waivers to prevent all of that from happening, to improve safety of our care of our older adults in the home, to address cost issues. We know that it is a very burdensome strain on our health system as it is, and we know that we do not have the staff adequately prepared to support this aging population in long-term care, and we know that these systems will crumble without any intervention. So we would like to see expanded access, we would like to see addressing disparities and inequalities, we would like to see improved care and broadened care for older adults, and furthermore, we would like to make sure that anything going forward that is implemented is really addressing the needs and the values and the preference of our older adults in a very ethically sound framework.